We totally understand your frustration because I think you came on this show because you were trying to settle the score because there were so many people challenging the statements that you were making and who you were presenting. But I think it's also important to speak to the fact that, yes, it's awesome that you've recognized that you have some issues that you're dealing with and you've been trying to address them. I know that you've shared with our producers that you go to therapy, that you're working on it. But I also don't want us to just brush past them because some of the issues that you discussed were quite serious. You mentioned borderline personality disorder. That's a tough disorder to deal with because somebody who has borderline personality disorder can sometimes have shifting self-concepts. They can sometimes have impulse control issues, particularly when they are triggered. And watching those videos, I think what we're concerned about is people make horrible comments sometimes. I mean, some people love you and they're like, we love these mukbangs, they help us, we love watching it. And then there are people who are like, you suck, you're fat, Miss Piggy, and then that triggers you. And so then it can make your binge eating disorder worse. And so that's sort of the concern, like when you're sort of in this field and doing what you're doing, and yet there's these two dimensions, and they also actually, by the way, apply to all of your struggles with expressing your gender identity, because we asked you, did you want to maybe transition or maybe represent yourself more as a male? And then you said, oh, but right now my business is really about giving the audience what they want. So that's the struggle that we're talking about here. Does that kind of make sense in terms of how you reconcile that and still try to get better from your borderline personality disorder and your binge eating issues?
I understand what you're saying. I'm a big advocate of talking about my issues online and stuff like that. So when I do eat, like I wish you guys did watch my mukbangs because every time I give a disclaimer that like I struggle with eating, I said I'm not eating all of this. I talk about it like all the time.
I actually have watched your mukbang videos. I actually watched several of your YouTube videos, and you're very dynamic on YouTube, and I think you're very friendly and you're very warm and loving, and I can see why people gravitate towards you. But you know what? People on social media, they're mean. And there are some people who love you and support you, and then there are some people, despite your disclaimer, are still gonna say to you, you're fat, stop eating, lose weight. And that kind of stuff, I think when somebody has eating issues, as you have had since your young age, it can be triggering even if you feel like you're in control of it.
I mean, I started mukbangs 2010. I started YouTube 2006, and people have said that since 2006. You know what I mean? People are like, and I was 140 back then, and I'm 170 now. So it's like, that will happen no matter what. I mean, I have to eat. I've gone through like eating disorder, like treatment and stuff like that, and like you have to eat. Like a big thing with like binge eating especially is like, I'm just not gonna eat so I can get skinny. And so like I have to eat, and it is food, and so I'm eating it, and yes, I like monetize it, but people will say that regardless, so it's not triggering.
Right, but you are doing a profession where you expose yourself to that a little bit more than you would otherwise, and so I'm kind of asking you, where's your resilience factors? So for example, one of the things that I really want to understand about you is, despite all of this, how are you trying to get better? How are you developing a healthy relationship with food?
I mean, I'm in therapy right now. I gave the name to the producers because I feel like people, like, I have to prove myself constantly to people, but I'm in therapy since May of this year. I've been in therapy on and off my whole life, but like consistent 3 times a week therapy since May. I do the DBT program. I do like group therapy, which I was very against for so long. At 31, I finally joined like group therapy. So I do all of that. I'm so much better. I mean, this year I was 5150 in a mental hospital in Alhambra, California, where I was like, you know, getting all this like treatment for that, and it's like, and I have never felt better than I do now. You know, they were gonna cancel my tour because I was hospitalized, and now I'm on tour and I'm doing all this stuff. So it's like, I am getting better for sure. You know, I wanted to bring awareness to the gender issue, which is why I came on originally. But then they asked me about the binge eating, and I'm very open about it, as I am with my therapist, and that is something that I haven't been able to conquer. I don't necessarily agree that comments trigger me in that sense because it's been like that my whole life. And even if people were like, you're so skinny, I'll still think I'm fat and that I'm gross and disgusting.